Hi, everybody. Welcome to the podcast. Today I have with me Erica Cody. So today with Erica, we're going to talk about thermography. So I'm going to have Erica just introduce herself and let us know what got her interested in thermography to start with, and we'll just go from there. Hi, Erica.
Hi, Cheryl. Thank you for having me.
Oh, you're welcome. Thanks for being on.
Oh, my pleasure.
So tell me what started your interest in thermography to just begin with?
Well, actually, it was at a dinner with Dr. Marcola, my husband, who is a chiropractor, and a group of chiropractors. We're all sitting down having dinner, and he was the one that first opened my eyes to thermography. And quite literally, he had me at non-invasive breast studies. And so that was the spark of the whole journey.
Yeah, because we're always looking for things that are non-invasive and not going to be putting things into our body that could be harmful. So that is definitely, I think, what a lot of people are looking for in thermography.
So yeah, non-invasive, pain-free. I mean, those are important.
So what is thermography and what do you use it for?
Okay, thermography means a study of change over time, basically. So what we're looking at is your thermal blueprint is telling us your body's physiology, okay? So where other technologies, they look for structure, we're not looking for structure, we're looking at the physiology. What is your body saying about what's going on, okay? So that's what thermography uses. So it's a camera. We have specific protocols where the patient will stand and position so that we can see their thermal blueprint. And then depending on what region, be it head, breast region, or chest in a man, the torso or legs, we follow a protocol.
So that brings me to an interesting question, because I think a lot of people know about thermography or have heard about thermography for breast cancer detection. People are trying to get away from mammograms because of the radiation and the pain of mammograms so they're switching over or looking more into thermography for breast cancer detection. But you talked about being able to do other areas of the body as well, and for men, which people don't understand that this can be used for men and women and all parts of their body.
Exactly. And even if it's just in the scope of breast cancer, okay, let's say that. Men get breast cancer too. 1% of all breast cancers are men, and unfortunately they pass away because they don't even know they should be thinking about it. So we're like very sensitive, us women. We try to stay on top of it, I think the majority. But
we're taught from a pretty early age that be checking and checking for lumps in our breasts, like probably.
But the same emotional, physical, chemical stressors that cause it in our bodies can cause it in their bodies. They're living the same world as we. So, but because we're women, we're more susceptible.
Yeah, because I think we're more susceptible because of the hormones in our body and because
the hormones. Yeah, there's a lot that goes along with it. I mean, I've been studying this for a long time, and I'm seeing like the bigger picture, which is very exciting. But as far as like different regions of the body, in my practice, we offer 3 packages. We will offer a breast study only, which includes 2 appointments that are 3 months apart, because again, it's the study of change over time. So we have to give it time. But the majority of the time, I will do a half body, which is pelvis bone up, because that talks about everything. That talks about your kidneys, that talks about your liver function, gallbladder function, digestive function, heart, cardiac, thyroid. Like, am I hitting some hot ones that people might want to know what's going on in their body about?
And a lot of these things are going to show up before you have any noticeable symptoms. So that's very important. I think people need to know that you should have a scan done when you feel like you're healthy.
Yes, I say that all the time. Get it while you're feeling really great and baseline it, because as we age, you know what happens. Things go awry. And then you'll have a baseline that they'll always go back to. The company that I personally use, which was the one that was originally recommended from Dr. Marcola. I love the way they handle things because they are so strict to protocol on they go back to that original scan. So it's so much easier to detect slight changes, even if it's 5-10 years down the road. And this whole shift that we have right now, and I'm so happy in the holistic care, is stop looking at structure first, which is typically an invasive process. Let's look at the physiology of the body that we can look at and analyze in a very non-invasive way.
Yeah, and just getting away from the symptoms. I mean, people often wait until they have noticeable symptoms before seeking any kind of care for preventative wellness, early detection, any of those kinds of symptoms. So
correct, and then you're chasing it. But if you can be ahead of it, if you can see the physiology of something that could start happening, it's kind of like having the ingredients in your cupboard, but it hasn't been baked yet. So you can change out some ingredients. You can, and I'm going to say, like, if we see that it looks as if there could be possible pathology developing, when we're looking at it in a very early stage, say 5 to 8 years prior to other technologies looking at it, that's the golden years where with diet, positive mental attitude, and just doing the good things for yourself, you can change it yourself. Like, you can own it without it owning you.
Yeah, you're not in that crisis mode already. Your body still has a lot of ability to heal and regenerate, and you're not waiting until it's too late. Not waiting until the car is completely demolished before you take it.
Let's stop before it's, let's get to it before it's a medical emergency. And I am knocking medical emergency. I will never, there was a point in time in my life I was completely paralyzed and I couldn't breathe. And they intubated me, and I am so thankful they did that. And I appreciate the medical interventions that I needed and they provided. But if we can stop from it being so much of a medical emergency and get to it when we can change it with food.
Yeah.
Let's do that.
So let's talk about some of the science behind it. What is the science behind thermography? You mentioned earlier that it can detect things years before a lot of the technology that we have now that we're using to detect things. So let's talk about that. Like, what is the science behind it, and what have you been reading about thermography?
Well, a lot of people think, which is easy to think, that it's like looking into your body. And it's really not. It can see a little bit into the body, but it can't really go deep. Like I had mentioned, we can talk about your liver, gallbladder, cardiac function, whether or not there's dysfunction or not showing any dysfunction, is because it uses the autonomic nervous system, the sympathetic nervous system, with what's called a postganglionic sphincter. And it sounds weird, but in short, it's a one-way communication from the organs to a specific patch of skin that the thermography camera can read and analyze.
Okay, so that can pick up is it picking up like low levels of heat, basically?
What we're looking for, honestly, is asymmetrics. Now, we all have thermal patterns. Some people think thermography is just about heat. No, because if there's dysfunction, say circulatory or nervous system that's not functioning properly, you're going to have cold, a lack of circulation, a lack of heat. So what we're looking at, there's two things they're looking at is symmetry. We were designed symmetrical. We should show fairly symmetrical. And when we don't look symmetrical, they look at the patch of skin that's different, say on the right side of the body than the left side of the body, say on the torso, and say that the one representing the kidneys is hot, warmer, so it's going to be the warmest color would be white in my system, then that's showing that you have dysfunction, inflammatory dysfunction in that area. And then our doctors recommend further investigation.
Cool. So when you started in thermography for yourself, you had a test done because did you have a lump in your breast that they found and you didn't want to do a mammogram? Was that correct?
Yes, it was about a year or so after I was paralyzed and still recovering from that. I had found 3 lumps in my breast and completely went into like a post-traumatic stress disorder zone. Like I couldn't breathe. I was panicky. I didn't want to go back into a world where I felt out of control. And my husband at that time, we sat down and we talked, and I said, what was it Dr. Marcoli was talking about? And he goes, yeah, thermography. And so I'm like, let's do it. And we went, and I was so thankful. When I had the scan done, typically we're trained not to say anything right away, but the woman could see what an emotional state I was in. And she literally, all she said was, as she can tell, as it presents, it did not look like pathology. And when I got the report back, it was correct. It was hormonal. And that relief that I felt at that moment, I felt completely in love with thermography and knew this was the direction I really wanted to go in.
Yeah. I mean, it's definitely an option I think a lot of people need to look more into. And around here I think I've looked into doing it myself, and I haven't done it, honestly. Because I was looking for someone to do more of a full body or at least half body scan. And the only people I could find around here were doing just breast, which is good in itself to have that done. But do you find that a lot of thermography places are only doing breast or chest scans and not doing full body? And why is that?
You know, yes. I see that a lot of them do just stay on the scope of the breast. I think because it's, in a sense, simpler, it's quicker, it's simpler. When you start getting into the whole body, like, you need to know, first of all, you have to do your job well. And I take that very seriously. The health history, do your protocols correctly. And every single scan that I do, I submit to a group of MDs that are trained thermologists, and they know what they're looking at. So I think that that's very important in the process. Just like with an x-ray, you have a radiologist that looks at it and gives their expertise on it. We follow the same protocol. And I just think not everybody has got that system in place, perhaps, and maybe that's why they're not venturing out.
Yeah.
But I think this rule that, let's find out what's going on with you. Let's just see what your body's saying, and let's stay ahead of it. Be non-invasive unless there's an indication to go further.
And do you know what the statistics are or the studies show of being able to detect, like, let's say just breast cancer, because a lot of people think about it for breast cancer and they want to try doing breast scans to avoid mammograms and avoid the radiation. So do you know what the statistics are or what the backing is for being able to detect breast cancer versus mammograms?
You know what? I don't. I used to know those statistics, but I have just completely gotten away from focusing on it on that level. Typically what people ask me about is like false readings on thermography.
Yeah.
And what I explain to them is like a really good case. This is a good show of what a false reading in thermography is. It is actually somebody that I knew had a breast study done, and the area truly read as if it could have been developing pathology. But see, we don't diagnose. So all we did is indicate that this needs to have further investigation for her. So it's kind of like the economic finger pointer.
Okay.
We don't diagnose. So she went in and found out, even though she hadn't breastfed in 3 years, she had mastitis. And so those like mastitis, that infection and developing pathology can look pretty similar.
Yeah.
Regardless, it was something that needed care.
Yeah, and that's interesting because you wouldn't suspect to have mastitis if you hadn't been breastfeeding a child for 3 years. So it's interesting that that would show up.
Right. Exactly.
And what's your percentage of people that you take care of, like male versus female? Are you taking care of a lot of men now?
Actually, it is growing, and it's very interesting. I have a lot of wives that come in, and after they're done, and of course, I have pictures of men up so that they can think about it, you know.
Yeah.
And then they say, well, how can this help guys? And I'm like, well, we can look at their cardiac health. We can look at their digestive system, their liver, kidney, gallbladder function, and I said, and if the 1% chance that they have breast cancer, we're going to see that too. So
yeah.
They usually send their husbands in.
That's very typical, especially of healthcare practices in general. I'm going to kind of throw some men under the bus here, but men tend to really not take care of themselves until it becomes an emergency. So a lot of times with things like this, even with chiropractic care, we get women in and they'll bring their kids in, and the men are sometimes the last ones to come in under care. They just wait so long to do any of this stuff.
I think a lot of times we get them under the wife explains to them it's a lot cheaper to get thermography and get ahead of it than to pay for the care afterwards.
Yeah, well, it's always less expensive to take care of your body and to prevent things and be well throughout your life than to pay for the emergency care later, or at least the things that you can try to avoid. You want to avoid as much as possible.
But I feel as though within the last year, I have truly had more men, even single men, reaching out to me saying, hey, you know what? I think it's a good idea. Why don't I come in for a scan? And I think that's great. Like, they're listening now.
Yeah, that's awesome. I think that in general, the population is becoming more open to different modes of healthcare and looking at trying to have longevity in their life and living a healthy adult life. They don't want to be, crippled or in nursing homes when they're older, like they're seeing their parents now. They want to have a fulfilled older life, and they want to try to prevent, these.
Right. They want to enjoy their life.
Exactly.
It kind of circles back to like why I came into chiropractic. Why I came into thermography. So, I had my own instance and I knew that I loved it. And then a few years down the road from that, my husband was diagnosed with leukemia. And it was very shocking. And turned out that his leukemia is actually a birth defect. So it's the rarer, like 3%, where it's a birth defect, and his life was, trending towards that since he was born, and it had caught up with him. Some of it is he was a little bit of a do as I say doc, not as I do guy. So the health and the nutrition wasn't where it should have been for it to catch up with him, like in the later 70s instead of 40s. And when that had happened, I made a decision right then and there that, okay, I'm going to have to step up. And either I'm going to go back into engineering, or I am going to go after the dream and get the thermography, get it rolling, and help support the family while I'm still helping people in the same way I would at the chiropractic office.
Yeah, because you started off in engineering, so you are a lady who likes her science and her technology, right?
I do. I love my technology. I think it's just fascinating how technology can help us understand our body.
And this is a perfect way of bringing in some great technology and being able to help people live a healthier life.
It has truly opened my eyes and opened the door. So I've had my own practice for 5 years now, and I really love doing what I've done and helping people. But I started to become a little bit aware of when I would see the results and get the reports back and talk with the patients. And there is a little bit of a why that wasn't completely being addressed. And I'm like, okay. So I've been on a search for quite some time on anything out there that helps us figure out our body and what's going on. And so what I started to say before is thermography is half of what I do for people in this scope. So the other half of it, so thermography maps out the pain and dysfunction and possible pathology. So the other side, the other tool technology that I use is what we call an AO scanner. So it's a body analyzer that's frequency based and it talks through your brain. And with this system, we've found a link. I actually flew out to Colorado with a specialist out there where we put together this link between dysfunction that we find in thermography, mainly starting at the mouth, and how the lymphatic system gets congested and it pools and dumps into the breast, and then it starts a situation like a pond, a beautiful clean pond, and then all of a sudden water's not moving and it becomes stagnant. Well, what happens? It grows disease. So we're seeing this connection. So between the thermography and the picture that we see of the dysfunction and the results of the scanner asking the body what's going on, we have connected. Now we see the picture of thermography and where it is. And with the scanner, we find out what's the cause and what does this patient need to improve their health enough to help them overcome it. So it's like one hand helping the other. And yeah, it's all physically.
It kind of just completes the picture. And it really puts into perspective how segmented treatment is in Western medicine.
Yes.
And because the picture all goes together, and you have to have all the working parts: mind, body, brain, lymphatic system, immune system.
Exactly.
It all works together.
Right. One of the biggest things that I started saying to our patient base in the chiropractic business is, and it's the same theory, like when I was paralyzed, I had what they call Guillain-Barre syndrome. Okay. And I know where it came from, and I know how I was susceptible. I had just had a baby 9 months prior. I was sleeping about 4 hours a night, not necessarily all at the same time. I was burned out. I was exposed to half a preschool class getting the flu nasal vaccination, which does have a high shed rate. I was inundated. My body was not strong enough to overcome that, so Guillain-Barre started. And when I was in the hospital, and this is the same philosophy I carry today, I told them, do not tell me any statistics. Do not tell me anything about this, because this is my body, my story. Do not label it, and let's see where I go. And in 9 months, with chiropractic care, good decision-making, reawakening the body in the exact same way a baby would reawaken the neural pathways or develop them through eye movement, head movement, rolling, sitting up, crawling. My daughter used to out-crawl me for a while. It was heartbreaking. But through doing it that way and not labeling it, in 9 months, I was actually able to run a 5K.
Wow.
Pretty, not fast. So I carry the same philosophy forward with the two technologies. We're not labeling anything. Let's find the dysfunction. Let's find the cause. Let's find what your body needs. Let's lift your health base. Let's work on those weaknesses. And systemically, your body will improve.
Yeah, and it seems like a pretty minor difference. You're not really treating the symptom. You're expressing health. You're promoting health instead of treating symptoms when you look at it that way. And it makes a big difference. It makes a huge difference with people.
Yes. Yes. And I think once you take away labels, an example. I had a wonderful lady come in, and she did the thermography and she did the scan, and she was just telling me like, oh my gosh, I have, this autoimmune, that autoimmune, this, and I'm just exhausted. And at the end of both, getting the results back from both, I said, I have to tell you, you really need to stop looking at that label. And she looked at me and I said, because you are incredibly healthy. You make amazing health decisions. You feed yourself very cleanly. You have a positive mental attitude. I said, and of course you're tired. You have 4 kids. You run a business and you have a husband that wants your attention. Of course you're tired. And after that, I see her often in the community and she goes, thank you. Just thank you.
Yeah. Yeah. It seems like a little thing, but it's one of those things that really gets to me when someone gets an injury or a diagnosis and they're given a prognosis that you won't be able to do this again, or you won't be able to do that again, or this is your, percentage of survival, or all those things. Cause it really, really gets to me that people, it takes away their hope, I think.
Right. And where thermography and non-invasive care like this, what we're doing here, it empowers them. Like they don't go to a doctor, they don't go to an insurance company. They go to them. They get to decide. This is their health journey. What do you want to do about it?
Yeah,
see them bloom into better health.
Yeah, it's their story to create. And I really, truly have seen people who have overcome seemingly insurmountable odds when they are given hope and empowerment. Sorry, we lost Erica just for a moment there, but we were talking about how taking away hope from people just takes away their ability to heal a lot of times. And I've seen people overcome like insurmountable odds when they have that hope and they have that trust in their body and its ability to heal, and they focus on their health versus the disease.
Exactly. Our bodies, by design, they were made to heal away, like subluxation, like dysfunction, and we have the ability to help.
No.
Okay.
So I know some people have some questions about cost of thermography. People have never had it done before and don't have any idea how much it costs. So you know what the range of different fees are for people who want to get in and do thermography?
Well, I think I'm kind of like on target. I can tell you what I charge. Now, when I do a package, especially for a woman, it always includes that 3-month follow-up. I really want them committed to doing that follow-up because it's that important. So for just a breast study, I charge about $320, including that second visit. A half body would be $450, again, including that follow-up, and a full body would be $575. And the full body is exciting because you get to see the legs, and a lot of women don't know when they have those like dangerous veins in their legs, the deep thrombosis, I might be saying it wrong, but can be actually dangerous for them. But with thermography, it really maps it out so that you would see, yes, this is something that we need to go, or you need to go take a look at.
And does that includes the interpretation by the MDs that you send it out to?
Yes.
Yeah.
All in. That's all in. So that's why I do it all, complete package. Here you go.
Yeah, because I think it's almost necessary, isn't it, to do an initial scan in the 3 months? Because you, like you said, it's not a one and done thing. It's how your body changes over time.
Right, because the initial scan might show asymmetrics, but that could be just your normal thermal path or your normal blueprint, It could just be you. So that's why it's so important to do. And I have had patients where, we feel every 3 months, like if it looks like something could be developing, every 3 months is a great time to rescan. That gives you time to make changes, but time to redirect if you need to, okay? So, and I've followed many beautiful people, 3 months, every 3 months they come in, and I've seen them come through it and their scans completely clear up and become stable, and they're healthier than they've ever been in their life. Yeah. So that's why it's so important to follow up and so understand what your body.
You do the first one, then one at 3 months, and then do you do another one at 3 months? Or it depends on what the scans show?
It all depends on what the doctors say. That's why it's so important that you have doctors involved that know what they're looking at, because they will tell you, that they feel you need to follow up again in 3 months, or they will tell you that you have a baseline and you can go annually.
And what ages is our thermography scans good for?
I have actually scanned children, younger ones who have had dysfunction that doctors have had a hard time figuring out, and this has helped map it out. But typically I start seeing women about mid-30s, but there's also been a movement where they'll start bringing their younger daughters in, because breast cancer is happening at a younger and younger and younger age lately. So now there's a little bit more of a push to get the younger women in to baseline.
Yeah. Well, and because this isn't really it isn't necessarily just a diagnostic test for breast cancer. It's looking at the function of your body, and you can, like you said, you can start making changes in healthy habits and dietary changes early on to promote health, not just to fight disease.
Exactly. I can tell you, just with my children alone, my daughter had always had like a very sensitive digestive system. And she went through a period of time right when I got my camera. Every night at 3:00 in the morning, she woke up and threw up. And it was very frustrating. We couldn't figure out what was going on. So I said, you know what? She was my very first study that I did. And it came back with her digestive system being inflamed. And it was suggested to look at allergies. So I did. I took her to one of my holistic doctors, and he muscle tested her, and corn was a huge problem. And even if it was organic corn, it still was not liking, her body was not liking the corn. So we eliminated the corn, and it helped her situation. And then with my oldest son, who's now 30, he has been telling me since he was 12 years old that he always felt like he was in pain. And I'm like, you're a young man. I don't understand what you're talking about. And so we finally scanned him, and his results came back with he was autoimmune, because there's a specific autoimmune marker that thermography can see plainly. And according to his symptoms, and he went and saw his doctor, they diagnosed him with a rare case of severe fibromyalgia in a young man.
And how old was he when you scanned him?
He was 26.
Okay. But he probably could have benefited from it at an earlier age.
Right.
Yeah.
Yes.
And is it safe for women to do while they're pregnant, or is it recommended because there's a lot of changes going on during pregnancy?
It is safe. There is no harm. There's no contraindication. It's just if they're looking for a breast study, that's not a good time to do it. But I have scanned women that were having other issues, other dysfunctions going on, mainly when they were nursing, but a couple of pregnant, well, actually one lady didn't know she was pregnant until I scanned her. Funny. That was a surprise, so she was delighted. But we can see dysfunction in other parts of the body, but it's not reliable for a breast study.
Yeah. So if there was something you wanted people to definitely leave and know about thermography, what would that be?
Thermography doesn't lie. That's something that we all kind of look at, us practitioners look at each other and say, but for the most part, it is an amazing, non-invasive, reliable, repeatable technology that you could use to help map out your health journey.
And is there a place that people can go to find places that are good thermography studies that they can get done?
Yes, and I'm glad you asked that, because I get questions all the time on Facebook. I'm in Arizona. Who can I go to? So there's a website. It's called ACCT. I don't know the whole thing, but if you Google ACCT for thermography, it's going to take you to the ACCT website. And under there, you can find clinics that use the same thermography that I do and associated with the same doctors that I rely on. And you can find it all over the United States, even in other countries.
Oh, cool. Awesome. Because I know I have people all over the United States that are listening to this podcast. And I think actually the next highest country I have is in Spain. So maybe there's some in Spain for people who want to.
Exactly. And another thing that's really coming up the works, and I love to mention this because I do it, like you had kind of mentioned before, you noticed that I love horses, which I really do. I actually have a horse thermography camera that is just for them.
Oh, wow.
And, that we can absolutely help give them a voice when they can't tell us where the dysfunction is.
Yeah, because you can do this on animals just as well as humans, right? If you have the right equipment.
Absolutely. I had a friend of mine, he had a polo pony, and he was complaining that his pony was just misbehaving. Matter of fact, I just wrote an article on this. And I'm like, well, why is he misbehaving? And he goes, I don't know. He's just doing that. And I'm like, I don't think so. I said, would you let me scan your horse? And he goes, sure. Well, we found out he had an infection in his jaw, in his lower jaw. Well, of course he's going to throw his head. The bit's probably hurting him. He's in pain. So he was able to get treatment, and then he stopped, quote unquote, misbehaving. So he felt better, and then he could enjoy playing polo like he likes.
I know it's these little things that you can't see, and you probably couldn't see that from the outside, and you just, you can't see that without getting these kinds of tests done and seeing more of the function of what is underlying those issues. So
looking at their physiology.
Yes. So, well, thank you so much for coming and sharing with us. If people want to reach out to you, how do they do that?
Oh, they can go to my website. It's northwesthealingcenter.com, or they can look me up on Facebook. Again, look for Northwest Healing Center and call me 224-600-3216. I'd love to answer any questions you have, and blessings to everyone.
Yes, and I think on your Facebook page you have some good videos and information, and your website as well. So thanks again for coming here and sharing with me today on the podcast. I hope more people look into thermography for a non-invasive approach to promoting their health and wellness.
Absolutely, and thank you for inviting me.
Thank you, Erica. We'll talk to you later.
Take care.